highly unusual, even made even more unusual because it's pulsatile. So I'll explain what that is. Once we remove all this debris in the ear canal, you'll be able to see a perforation of the eardrum, quite a large one, and that's been there for a long time for this patient, so it's a well-known fact. But when we peer a little bit further in with the endoscope, you'll be able to see on the middle ear wall a little pocket that's kind of pulsing. So it's clearly moving back and forth with the patient's heartbeat, and that's the dehiscence. So what it is a lack of bone, such that there is almost like a little membrane or window. So usually when you talk about an ear dehiscence or middle ear dehiscence, you'll usually come across something called semicircular canal dehiscence, and that's been documented in lots and lots of times. There's lots of papers on it, and doctors talking about it online. And semicircular canal dehiscence is where you have a little loss of bone, but it's over one of the semicircular canals. So semicircular canals are part of your vestibular system, and the semicircular canals allow your brain to kind of interpret where your head is moving. So if I want to look directly at the camera and I move my head this way, my semicircular canals inside my inner ear are telling my brain that my head is moving this way, and then to compensate, my eyes move to the right so I can stay fixated on an object. And when you have the dehiscence of the semicircular canal, so you have a little membrane, a little window which should not be there, the semicircular canal should be encased in bone. Patients get a variety of unusual symptoms, so they'll have vertigo, they will have unusual auditory perception, so they'll be able to hear themselves breathe and chew. Some people who can report hearing their eyes move. Okay, and all of these things are characteristic of semicircular canal dehiscence. So this isn't that, but even though this dehiscence isn't over semicircular canal, you would expect at least some kind of weird symptoms. So you would expect maybe a little bit of vertigo. Given that it's pulsatile, you would expect the patient to be hearing some kind of pulsatile tinnitus, maybe a shh, or some kind of beating along with their heartbeat. This patient does not report anything. There is no unusual symptom whatsoever, other than, of course, the hearing loss, which is caused by the perforation. So that kind of implies that the dehiscence does not open into the inner ear. So the reason why it's pulsing, that is really the mystery of the case. So you can just about see the perforation back there. I'll mark it with an arrow because it's very, very clear. You can also see the handle of the malleus just coming down there, sort of the top left portion of the perforation. So the reason why it could be pulsatile remains to be seen. This person is going to be referred into the NHS. Well, they already have. So I've already referred them in, and they're going to be seen by an ENT doctor for most likely a CT scan. So I shared this footage with an ENT doctor that I work with because I'm really not an expert doctor said that it was a nuisance, possibly